Hello, everyone. I hope you can all see me fine. I am doing a live event today with regards to everything donor. So it is 7 o'clock now, so I suppose I should get started. I'm Dr. Manny Mangat, and I am a fertility specialist who is subspecialised, so a CREI, and I work in Greenwich, our York Street service, and Burwood, of which I am clinical director. And I do all aspects of fertility. So I treat general fertility as well as patients who need donor support and everything from womb to tomb, as they say. So my aim of being here today is to navigate through these uncertain times with COVID where we can't see you guys face to face, and we would otherwise love to be there with you doing these talks and webinars, and it's so much more fun face to face. But anyway, look, we're going to make this interactive and fun, and I know you've done a few of these with some of the other specialists. Hi Lou, hi Rainbow, I can see your comments coming up now. So I'm going to be here for the next 30 minutes to answer any questions you might have. So just sort of as a background, today, as I said, we will be sort of focusing on our donor program. And so questions surrounding that would be good. However, I can answer any questions that come up. And as you know, our donor program is a very well-run group of people who have come together in an experienced team to help navigate this sometimes difficult journey for patients. So there's a group in our admin, as well as our counsellors and your fertility specialists, who together navigate all the different aspects of using donor eggs or donor sperm. Some people may need a donated embryo, other people may need a surrogate, and that is where we coordinate the whole process, making it as straightforward as possible for you. Now, the legislation around this actually is different between state to state, and that's why the legal framework can be quite confusing for patients considering to use a donor. And often patients want to know, the simple and straightforward path of information that they need. For example, in New South Wales, a donor can create 4 families and the 5th one is their own, whereas in Victoria, they can create up to 10 families. So it is all very different. So at IVF Australia, we offer workup for known donation as well as for de-identified donors. So we have a donor sperm bank that has been established for the last, over 20 years. Now we have donors that we recruit from overseas as well as locally. And obviously now with COVID and the current situation, we are focusing more on our local donors. But there's also, as I said, embryo donation and egg donation, which I can talk about in more detail if needed. Now, Rainbow has a question. Embryo adoption will be our last resort. What are the procedures for this? Rainbow, I hope we can help you before you get to that point. But knowing your individual circumstance obviously is not our privilege in this forum. However, when it comes to using an embryo, I guess what you need to decide is the reason for why it might have been difficult in your own fertility journey. So for example, if you have gone through early menopause or have a very low egg reserve and don't have enough eggs, then we might just need an egg donor. And if you are in a heterosexual relationship, we can still use your husband's sperm. Therefore, that will be looking at egg donation. But if things haven't worked because there's a problem with your husband's sperm, then obviously we may be looking at a sperm donor rather than the egg. And some couples decide that if they are going to use a donor, they might then just use a donated embryo. And embryo adoption is where you use an embryo that has been created already by another couple or by another egg and sperm donor. And obviously, we also have single women who adopt embryos. And as I said, there are many different families and many different requirements for people, and each circumstance usually is individual and best discussed with your fertility specialist. But in our clinic, we have an embryo donation list. So basically, if you have come to that point with your fertility specialist, you would contact our donor team and you would fill in your profiles to go onto our embryo donation wait list. So the difference with adopting an embryo, Rainbow, is that you put your profile on there and the embryo donor actually selects you rather than you selecting the embryo. And the wait time is very variable because it depends on when an embryo donor selects you. However, there are many reputable clinics overseas because in Australia, donation, as you know, of any sort is altruistic, meaning we cannot pay or have a commercial interest in the donor. Therefore, egg donors and embryo donors in the past were not as abundant, now becoming more common as people are getting more educated about all of this. However, overseas, they have historically always had very large egg banks and larger embryo banks because people get paid for their donations. So there are some clinics we utilize overseas, which I have patients going to all the time with great success stories who we can organize embryo donation via. And obviously now at the moment there are border restrictions because of COVID. But once all that clears, it's then, simple process of us organizing it. So we get your body ready here, your lining ready here, and then you just fly over to get the embryo transfer, and we can organize all of that in as quickly as 6 weeks time, 6 to 8 weeks. So it's pretty quick. Adeline, you've said, can single ladies use donors? Yes, you definitely can. So a large percentage of our patients who use donor sperm are single ladies, and that is definitely legal and allowed. Now, with regards to cost, it depends. So if you have come in with no medical problem, then you don't qualify for a Medicare rebate. But if you do have a medical problem, or there are certain criteria you can talk to with your fertility specialist, that will then still qualify you for a Medicare rebate as a single person. So those exact costings will change whether the treatment is insemination or IVF or what you're using that sperm for. So the exact costing would be better given to you by our 1-800 number. So you can call our general inquiry number and they can send you out a pamphlet which will go through our general costing. The actual cost to use the donor sperm, there's only a small fee attached to each treatment cycle for the sperm that you use, but you will probably want an overall picture of your overall treatment cost. And Violet, I assume when you say your question is above, that is referring to if single ladies can use sperm, and yes, the answer is you can. Kaya says, being in a same-sex relationship, we both want to swap eggs and carry each other's eggs. How do we go about this and what should we do to get started? Amazing question, Kaya. So what we consider that is considered embryo sharing or egg sharing. And what we would suggest you do there is you get a referral from your GP to see one of us, and we will go through the process with you. So we normally do some investigations of blood tests and ultrasound for you and your partner to get your egg reserve and your general endocrine tests and ultrasound, etc. And then we will decide which partner goes first. So let's say if your egg reserve is a little bit lower or you're a little bit older, then we might do an IVF cycle for you first, Kaya, use a sperm donor, create embryos, and then transfer it into your partner for a pregnancy. And, when that baby has been born, then your partner can come through, or even before having the baby, your partner can go through a cycle to create eggs, and we can use the same sperm donor to create the embryos and then keep those embryos either at the time when you're ready for next baby or make them beforehand and then transfer when you're both ready. So to get started, GP referral and your fertility specialist will talk you through it. And thank you, Rainbow. Yes, thank you. Rainbow says that she feels she's in good hands and we're all awesome. Thank you. That's very nice of you. And at what point do you, Jenny has asked, at what point do you recommend people stop trying IVF and go for embryo donation? That's a very, very good question, Jenny, because everybody's individual journey is going to be different. So the first thing we need to look at is how old you are, how how many times you've tried. Are you making good quality blastocysts? If so, how many? Are those blastocysts normal in their genetics? Have we tested everything we could have with your implantation and any other reasons that pregnancy may be failing? Statistically, ANZA database suggests that in 5 to 7 stimulated cycles, we should get a good idea of the cross-section of what's left in your ovaries. But, some people may put a personal cutoff and say, look, I'll give this 3 goes, and if it doesn't work, I will then progress. Some people may not be ready to let go until they do 5 or 6 cycles. But remember, we have fertility counselors to help guide you through this. A lot of the time, besides being a medical decision, it is an individual discussion with your fertility specialist, as well as a financial and emotional decision. But if we feel that we have tried absolutely everything and you have given it, as I said, at least 3 or more good goes, and there's no more that we can test or change, then it might be time to start, reconciling with that and start the process of considering a donor. Nicole says, Nicole, you're single and 43. If you use donor sperm, do I have to use a donor egg because of your age? Well, Nicole, we use your own eggs until you are 45. So from your 46th birthday, chances of success using your own eggs are very, very low by then. And so we would recommend that you consider an embryo donor or an egg donor with the sperm donor by that point. But at 43, you should definitely speak to someone ASAP, and we can run some tests and see what your egg reserve is and then guide you from there, hopefully, getting you there with your own eggs. And with regards to Nicole's next question was, hello. Sorry, if you guys can still see me, my screen has just gone black. Oh, I'm back. Sorry, guys. That was my monitor. It just decided to give up all of a sudden. I'm so glad I've got you all back. Someone posted a question to show me that we're still live and I'm still talking and everybody's good. Okay. Nicole, you had a question here about a second question, which says that if a child is born from a donor, can they find out who the donor is? Yes, absolutely. So in Australia, all donors are not anonymous anymore. They are de-identified at the point of donation. And what that, thanks, Sandra, and what that means is that you get a photo of the donor as a toddler. You get their physical characteristics, their education, occupation, any relevant medical history, a personal note, their quality of the sperm, how many families have been created, but you don't get their identity at the point of choosing the donor. However, their identifying details have to go onto a central register, and that is mandated by law. So the child can access that register at 18. So yes, any kind of donation in Australia has to be recorded, and the child has the right to access that register at 18 years of age. Okay, so hi Olivia, that's one of our lovely embryologists who's on there with us. So basically there have been some fantastic questions here. So just to reiterate, when it comes to any donor program, the most readily available would be sperm donation. As you can imagine, it is much less of a process for a man to come in and give a sperm sample. All our donors have seen a doctor. They have all been worked up with their history. They have all had their genetic counseling. They have had general counseling. They have also had all their blood tests and their infection screens done. We also do a preconception screen where we look at about 500 different recessive genetic conditions that people may carry for your added safety. We check their sperm, check the quality of their sperm in a sperm donor, for example. That sperm is then quarantined for 3 months. Infection screening is retested to make sure that everything is, clear and good to go. And then they are put on a list for you to peruse. And rest assured that's making it as safe as possible for you, rather than just ordering sperm online or meeting someone in the big wide world. Hi Joe, nice to see you on here. Hi Pam. Oh, it's nice to see a few familiar faces. Pam is one of the lovely people on our donor team. So yes, as I said, we have a team of people that look after you to answer your questions. So as I said, we were talking about sperm donors before, and so they're thoroughly screened and then put on this list. So as a patient, you will need a referral from your GP to see one of the fertility specialists, and then we will go through with you your history and do some tests to see where you're at, and then counsel you. And if you feel that the donor situation is appropriate for you, you then go on a wait list. So once you go on the donor wait list, there's a cost for that. It's a $150 fee. You then wait a given time before you can actually access the donors. So the time you wait depends a little bit on the treatment that you're doing. So if you were doing IVF using donor sperm, for example, the wait is 2 to 3 months. But if you were using IUI or intrauterine insemination, the wait is 6 to 9 months. Now, remember, if you have a known donor, so what does that mean? So let's say you have a friend who's agreed to donate sperm, then they have to have an appointment with us, and they get worked up the exact same way as our donor bank, and they will have bloods and counseling and their preconception screen and sperm frozen, but you only have to wait the 3-month quarantine for their sperm to be ready before you're then ready for treatment. Vicky here says, what is the age cutoff to be the recipient of an egg donation? Good question, Vicky. So if you're getting an egg, you would want it donated from a younger person. And as the recipient, we treat you right up to the age of menopause, so your 52nd birthday. Now, remember, when we talk about egg donation, the success of your pregnancy will largely depend on the quality of the embryo, which is contributed by the quality of the egg. So the younger your egg donor, the higher your success. Our ovaries age, but our uterus really doesn't age very much. And that's why we are able to continue to get pregnant even, until 50, 51. Obviously, overseas, you see a lot of women even pregnant at 65. But in Australia, for ethical reasons, we cut it off at the age of menopause. Jules, lovely to see you on here. And Mark, can you tell me the surrogacy process from a male's perspective? What obligations would I have? Mark, clarify your question a little bit for me, because are you talking about your female partner requiring a surrogate because of issues, or are you talking about being in a same-sex relationship where you then require surrogate? In general, surrogacy is allowed in Australia, but it has to be for medical reasons. So, for example, if a woman has had trouble, recurrent miscarriage despite chromosomally normal embryos, or if they have lost their uterus, or if they have had cancer and have a life-threatening medical condition that makes them unable to carry a pregnancy, or some people are born without a uterus, Myra-Rokitansky-Kuster-Hauser syndrome, then there are medical indications. So yes, definitely we can consider a surrogate, but again, in Australia, you can't pay your surrogate. There's no commercial interest. You just pay for their medical costs, and you'll have to find your own surrogate, and there are a few criteria, like you have had to have known the surrogate has to be healthy, they've had to have had a child, they've not had to have obstetric complications of their own, and then we go through the ethics committee, get that approved at a clinical level, and then the surrogate is worked up before the frozen embryo created is put into the surrogate. Now, the difference of surrogacy in Australia compared to other countries is that the surrogate cannot have a genetic link to the embryo. So, for example, if a same-sex couple choose a woman to be their egg donor, that woman cannot then also be their surrogate. So they have to have a separate egg donor and a separate surrogate. Now, the birth mother in Australia is the legal parent of the child. So if you use a surrogate, by law, the surrogate will be the legal parent. So that's why you have to have counseling beforehand, independent psychiatric assessment, independent legal advice, and a parental order drawn up that rightfully puts the child back to the parents rather than the surrogate at birth. So it is a bit of a process which we can help you organize, and I hope that answered your question. Now, Kate, is there a long wait list to make an appointment? We can always fit you in. I'm sure I can find you somewhere. You just have to ring my PA and ask for an appointment, and that's not a problem. Karen, how are you? Has the wait list for IVF been impacted by COVID? No, not at all. So, I suppose the impact is that we are not looking at bringing sperm in from overseas or getting, more of that process or stock at this point. We're mainly using our local donors, but local donors still going strong. The government, thankfully, has lifted the ban on elective surgery. We are so grateful that we can continue to help you achieve your dreams. IVF has gone straight back to normal. We're back to being crazy busy. So, the timeframes for the waitlist should not have been impacted greatly by COVID. Amy, just had my second daughter a month ago. Thanks to Dr. Quick. How long do we have to wait before trying for another baby with IVF? Amy, that depends. So if you've had a normal delivery, then it depends on whether you are breastfeeding or not. So if you are still breastfeeding and don't have a period and you want to try on your own, obviously we have to wait for a period to return. If you have had a cesarean section, for example, then you have to wait a little bit longer, because we usually suggest that your second trimester should be a year post-Caesar. So you start trying at about 9 months or later. So that depends on where you're at. Hi, Nicole. Nice to see you on here. As I said, it's so lovely to see so many of, all you amazing people and patients. This is what makes our day. Now, I've spoken quite a bit about sperm, and there's known and de-identified donation. I suppose we've also touched quite a bit on surrogacy as well as the legalities. So, Mark, I hope that answered your question. What we haven't spoken about much is egg donation, I suppose. And egg donation, we also are trying very hard to have a local list that you can access. However, as you can imagine, because egg donation and any donation is altruistic in Australia, a woman has to go through injections and an IVF cycle to actually fall pregnant. So, to actually be prepared to have her eggs removed. So it's quite a process, as you all know, and therefore, if they're not reimbursed for it, most people don't put up their hand and come forward and say, hey, I'll donate my eggs. So it does happen. There are many kind souls who will actually go through the process for no gain, but it's a few patients who come forward every few months. So our egg donation list is probably not as large as we would like it to be. And what happens there is that you again put yourself on, fill your profile and put yourself on the list, and then the egg donors come on and they get to look at the profiles and they actually select someone as their recipient. So it's the other way around to sperm donation. But as I said, our main egg banks are overseas, and a lot of our patients go to different clinics overseas, be that in Europe or America or Hawaii, to go and get donor eggs, and we organize everything we organize everything for the patient here, and basically you just select your donor, they go through a cycle, and then you head over there if you have a partner before the egg collection so that they can give their sperm sample, and then once the embryos are created, you have a transfer and you come home. So that's overseas egg donation. But remember, keeping in mind with COVID now, again, everything's been affected and borders are closed, and poor patients, you can't even go overseas to access any of this. So it feels like a lot of it has been closed in. So our clinic is looking at different options to see if there is anything we can do to open up, either marketing to more people to donate eggs or bringing eggs in from overseas, or we're just looking at every avenue we possibly can to help people. So that's where we're at the moment. And obviously keep a lookout on the Facebook updates and on our live pages and our website to for any new updates. Amy, that's great. Yeah, I wish you, all the very best with your second baby. Now, with regards to specifics, I suppose, of any other questions you may have, are there any other parts of the process that you would like to know? So I suppose, as I said, as donors for sperm, things are run through our central team. There's known, there's de-identified, the process. They have all been screened, infection screened, everything quarantined. For eggs and embryos, we collect a list. You have to put a profile, they choose you. Wait times depends on what we're doing. With sperm, as I said, with known donors, it's 3 months quarantine. With de-identified donors, it's 2 to 3 months for IUI and 6 to 9 months for IVF. 2 to 3 months for IVF, 6 to 9 months for IUI. Eggs and embryos can be a little bit different because it depends on when you get selected. With regards to what you have to do, how about I touch on the recipient? So if I am a single woman or same-sex relationship or a heterosexual couple who needs to use an egg donor or a sperm donor or an embryo donor, the first thing you should do is see your fertility specialist with a GP referral so you get a Medicare rebate. And once your doctor has seen you, we will basically go through your basic investigations like your egg reserve, your endocrine profile, your infection screening, and ultrasound. Once you've done that, we will then go through whether there's a medical reason or what the cost is and whether you qualify for Medicare or not. Once we have ascertained all of that, you then go on your wait list. And as I said, the time on the wait list depends on the treatment we choose. During the wait time, you will also have 2 sessions of counseling. Counseling is mandated for all donor gametes. So we have in-house counselors. You don't have to go and find counselors who will take you through the process. And that basically just goes through the implications, any questions you may have, what the legalities are, how you may choose to tell the children created in the future, as well as collecting all your details to go on the central register that I touched in a question beforehand, where you will get your your details along with the donor's details and the child created all on the central register that the child can access at 18 years of age. Now, over time, laws may change and children may actually be allowed to access that list earlier, but at this point, they access it at 18 years of age. I also touched on the fact before that when you select a donor, you get a de-identified list of information about them, which is a photo of them as a toddler, their physical characteristics, education, occupation, any relevant medical history, how many families they've created. Remember, I said they can only donate to 4 families. The 5th one is their own family. And you will, what I should also mention is that, if this donor has created 2 or 3 other families, we have a program called Donor Siblings. So we keep the demographics of those other families. So if you are interested and you want to know where the other families are, if you want to get in touch with them, we can actually facilitate that process. So so that's an interesting part too. Now, Michelle here has a question. How much is IVF? That's dependent. So as I said, if you don't qualify for Medicare through the premium service, it's about $9,500. plus medications. But if you do qualify for Medicare, you get about 4,800 back for your IVF cycle, so that halves the cost. But there will be a cost for your egg collection and embryo transfer, and that's usually covered by your private insurance if you do have the appropriate cover. So again, call into our 1-800 number and we can send you in more sort of accurate costings. Jules, with overseas donors, is it right the donor is de-identified in most countries? Is there any evidence on the pros and cons of identified versus de-identified? Excellent question, Jules. Unfortunately, that is correct. Most of the overseas donors are de-identified and anonymous, meaning you only get similar information as I've explained. So you actually, let me correct myself. A lot of the egg donors overseas, for example, it varies by country. So let's say you go to Hawaii or the States. Now you will get a thesis about that egg donor. So you will get a photo of them as an adult. You will get to know, you don't get their identity, but you get their photo. You get their background, again, their education, their occupation. They usually write your history about themselves. They usually write to you about whether they have had their own family, whether they've donated, how many times they've donated, if it's been successful. Like, you can get a whole lot of information about them. And they also usually have information there about their medical history, their family history. So that's all very comprehensive, but they don't have a register. So there is no guarantee by the clinic or the government or anywhere as to whether you can ever trace them again in the future. So if you do tell your child and they then want to find this donor, that is where the difficulty comes. So you have, a lot of information about them, but no way of necessarily tracing them. Some clinics will say that they actually will facilitate that process, but I guess because there is no central register, it will just depend on how they how they actually find these people later. With the pros and cons of identified versus de-identified, I guess the pro is that some people still don't feel comfortable telling their children that they have been created using donor eggs or donor sperm. However, we always encourage parents with open disclosure. So most people now feel they tell the child of, and there are different ways of explaining or telling, however you want to say it, which our counselors are very good at helping with, as to what you tell the child and when you tell the child. And I guess the con is that if this is an anonymous donor with no way of tracing the donor, then you end up with, the TV shows where, there was an Insight program a few years ago where children really tried very hard to find these donors, and a lot of them were sad and unhappy when they couldn't actually trace back this genetic link. A lot of them didn't actually want to find the donor. They were, because you are still their parent, but they just wanted to know this genetic link. So I guess that's the biggest con of the possibility of not knowing. Rainbow, is counseling on telehealth as well? Can we access it via Medicare? I believe with the Medicare section of it, I have to double check because, as you know, telehealth and Medicare changes all the time. So we didn't even have Medicare rebates for our telehealth consults until only about 3 to 4 weeks ago. So whether you get a Medicare rebate, admin, if you call our 1-800 number, will be able to tell you the costing for counseling. But yes, they do it on telehealth. So at the moment, 90% of our work is done on Zoom while coronavirus is happening. If you have had IVF with us, your counseling is included in your IVF cycle. There is only a fee for it when you're doing it as part of outside a treatment cycle, or whether you're doing it in planning for using donor gametes, then yes, there is a fee for that. If we are counseling to prepare your known donor, then yes, there is a fee for that. Do you need to book it in? Yes, you do. So as I said, if you call our 1-800 number and inquire about our counselors, you can get more information on there about that. Okay, so I think we've covered all the questions now. I hope I've sort of covered, a little bit about most people's questions, etc. But it's a rather big topic, as I said, and we've touched on sperm, known de-identified, we've touched on egg, we've touched on embryo. As you know, there is local, but it's altruistic, and there's also overseas options, which is kind of a little bit complicated at the moment because of COVID. Costing, as I said, if you don't qualify for Medicare, after 2 attempts at treatment, you usually then qualify for Medicare. So for example, if someone does 2 attempts at insemination, then you're covered by Medicare after that. If you do have a medical reason, then you will be considered for Medicare from the beginning. Kate's got a question. How much do the IVF medications cost, and are they covered by private health? Unfortunately, most of the medications will not be covered by private health, because even if private health has a clause in it that covers for medication, their caps on the medication are quite low. So you may get a few $100s back for the medications, but typically in an insemination cycle, your medications are cheaper. You may get away with only $500-600 worth of medications. But if you're doing IVF, then the medication cost depends on the type of medication you're using, the amount you need, the dose you need. So it will depend on an individual basis. But as a ballpark, it'll be a couple of $1,000s usually, at least, for IVF medications. And your health fund, if you're at top cover, may give you a few hundred back, but usually there's a very big gap with medications. Jules, can you have more than 1 pregnancy with the same egg donor? Definitely yes. So most of my patients who've been successful with egg donation have usually had more than 1 embryo created in the cycle. And we have then either chosen to genetic test or not, depending on the age of the donor and the country we have chosen. And those embryos will be kept for siblings. So yes, definitely. Now, if we are getting donated embryos, however, then that's a little bit trickier, because you want to get more than 1 embryo donated, and therefore you can still have embryos from the same genetic link. Even with sperm, if you come through as to use donor sperm and we create embryos for you, you get pregnant, you've had your baby, we always try to hold sperm with the same donor for another pregnancy. And if you're a same-sex couple that come in and one of you have the baby first, again, we usually try to hold the sperm so the next partner can have the baby with the same genetic link. And that's the same with our egg donors. As we said, we try to make you a batch, and that whole batch belongs to you, and therefore you can use those embryos for siblings. And that's exactly how we always do it. Yeah. How are we going? I think we are almost out of time. We're 36 minutes into this. I will probably think we have another 5 to 10 minutes left for any other questions anyone may have, for anything that I may not have covered. Emma, replying to Kate about IVF medications. Yes, so Emma, you must be talking about medications in an IVF rebatable cycle. So if you qualify for Medicare, then yes, most of your medications are covered on the PBS. So you only pay for the script price of each medication, and that's about $38 per group of medication. So in total, it works out to be $150 to $200. That is absolutely correct. But if you are coming through for treatment and don't qualify for a Medicare rebate and you're paying for a full cycle, then your IVF medications cost a lot more. So if you're doing a cycle overseas, you don't usually qualify for Medicare rebate. If you're doing a cycle here without a medical reason, you don't qualify for Medicare rebate. So in some situations, you will be paying the full price, as I explained before. But we try our best to look at the situation and to see how we can, get you a Medicare rebate. And obviously, if you qualify for Medicare, then yes, your medications are very cheap because they're mostly covered under the PBS scheme. Thanks for that, Emma, to differentiate between the two things. Okay, so I think we have covered most things with regards to our donor programs, and I think everyone sort of gets the general gist of where we stand. So it's altruistic, sperm donor bank, we have a great bank. egg and embryo bank, we're working on our lists, but we can help all the time with overseas options. Costing really depends on Medicare or no Medicare or IUI or IVF. Counselling, as we said, we have it all provided. The registry we have discussed. The number of families we have discussed. The testing that you do, we've discussed. The testing the donors go through. As you know, we screen for these 500 recessive genetic conditions more recently, and that's great because if the donor carries, for example, cystic fibrosis, and if you are also a carrier of cystic fibrosis, you wouldn't then pick that donor because that, is you don't want a risk of actually having a baby with a problem. So yeah, so as far as screening and testing goes, rest assured, it's all taken care of in our donor program. Andrew, you're so beautiful. You're an amazing person and doctor yourself. And Michelle, hello. Oh, this is amazing. I've had such a good evening. So if no one has any more questions, as I think I've covered most things, does anyone want me to talk about the actual specifics of treatment? Like we've talked about all the preparation and what you can do locally and overseas, but I didn't actually touch on fertility preparation or the actual IVF cycle or insemination because there are other talks here that have covered it. So, just briefly, as you know, intrauterine insemination is where we look for your ovulation, and then we literally thaw sperm and place it in the body, so a more natural approach. And IVF is where you take your injections and grow follicles to maximize the number you're producing for the month and collect those eggs, put them together with sperm, and then do a transfer. Now, for egg sharing purposes, as you know, or surrogate cases, we usually freeze the embryos. We have the option of genetic testing them and then transferring, and fresh and frozen success rates are, equivalent these days. So without further ado then, I think we have covered everything. I won't bore you anymore. Probably back to dinner and family time on this Wednesday. So if you have any other questions that I haven't managed to go over, call in to our 1-800 number tomorrow. Call to speak to our donor team. Call to make an appointment with someone like myself. We're on Facebook. We are on Instagram. Please feel free to follow us somewhere. And we're always here to help you achieve your goals. And we're also happy that we are back and working and somewhat getting on top of this curve of coronavirus. So it's been a pleasure. Thank you so much for all of you who attended, and I've seen so many familiar names and faces here. It really is amazing. So I'd like to say good night. Thank you, everyone. All the best. Good night.